Good afternoon, folks. This afternoon's topic A is dealing with living well in the community, even during periods of acute mental illness, is not a contradiction. It is the promise and practice of hospital in the home. This emerging model of care delivers hospital level psychiatric and medical support directly where people live, replacing the disorientating, often traumatic experience of inpatient admission with a more humane, stabilizing, and recovery oriented alternative. For many individuals, especially those navigating acute episodes of depression, psychosis, anxiety, dementia related behavioral crises, home is not only a safer setting, it is the environment most capable of supporting healing, identity, and dignity. Okay, guys, here's the title: Hospital in the Home for Acute Mental Illness, Living Well in the Community, a shift in philosophy of acute care. Okay, for decades, acute mental illness has been treated as a condition requiring removal from everyday life. Psychiatric hospitalization, often involuntary, often prolonged, became the default response to crisis. Yet, research and lived experience increasingly show that the hospital environment can worsen confusion, escalate agitation, and disconnect people from the relationships and routines that anchor their well being. Sensory overload, rigid schedules, and unfamiliar surroundings can exacerbate symptoms, especially for people with dementia or severe anxiety. Hospital at home, hospital in the home challenges this paradigm. Instead of transporting the patient to the hospital, the model transports the hospital, its clinicians, diagnostics, monitoring, and therapeutic interventions to the patient's home. This approach has already demonstrated safety and effectiveness for medical conditions such as heart failure, COPD, and pneumonia. Now, behavioral health programs are adapting the model for psychiatric crises, with early evidence showing promise. Why home matters in mental health. Home is not merely a physical space, it is a psychological ecosystem. Familiar objects, predictable rhythms, cultural practices, and trusted relationships. These elements reduce stress hormones, support orientation, and reinforce identity, all critical during acute mental illness. Reduced sensory disruption. Hospital units are noisy, brightly lit, and unpredictable for people with dementia. This environment can trigger delirium, agitation, and rapid functional decline. Home based acute care avoids these triggers. Preservation of autonomy. In home care allows individuals to maintain control over their routines, meals, clothing, and personal space. Autonomy as a therapeutic asset, especially for people experiencing depression or psychosis, where loss of agency can worsen symptoms. Stronger family integration. Families are not families are not visitors. They are partners. Home-based acute care models incorporate caregivers into planning, monitoring, and recovery, strengthening the support network that will remain long after the crisis resolves. Cultural and community continuity. For many people, healing is inseparable from cultural rituals, spiritual practices, and community presence. Home based care allows these elements to remain intact. How hospital in home works for acute mental illness. Programs vary, but emerging models share core components. Multidisciplinary psychiatric teams, specialized teams, psychiatrists, psychiatric nurses, psychologists, social workers provide daily in person visits, virtual consultations, and 24/7 remote monitoring, mobile integrated health paramedics. These clinicians deliver urgent interventions, medication adjustments, and crisis de-escalation directly in the home. They also prevent unnecessary emergency department visits. Rapid escalation pathways. If symptoms worsen, teams can escalate care immediately, including transferring the patient to inpatient care when necessary. Safety is preserved without defaulting to hospitalization. Virtual call button access. Patients can reach clinicians at any time, monitoring the responsiveness of inpatient units, diagnostics and therapeutics at home. Programs provide labs, imaging, IV medications, and medication management in the home, essential for patients with co-occurring medical and psychiatric conditions. Evidence emerging from behavioral health trials. Two major incentives are shaping the future of psychiatric hospital in the home. Mass General Birmingham Dementia Trial, a randomized controlled trial enrolling 200 patients, evaluates whether proactive home-based acute care can prevent traumatic ED visits and inpatient admissions for people with moderate to severe dementia. Emergency department to home psychiatric pilot. This first of this first this first of its kind trial test whether individuals presenting with acute psychosis, severe depression, or anxiety can be safely stabilized at home instead of being admitted to an inpatient psychiatric units. Both trials aim to address long-standing inequities, psychiatric boarding, bed shortages, and the exclusion of cognitively impaired or severely ill patients from home-based acute care models. A behavioral health system under strain. The U.S. faces a severe shortage of psychiatric beds, 13% fewer state beds in 2023 compared to 2010. In Massachusetts alone, up to 700 people may wait daily for psychiatric care, often boarding in emergency departments for days. Hospital in the home offers a structural solution. It expands capacity without building new facilities. It reduces ED boarding. It prevents deterioration caused by prolonged hospitalization. It brings care to people who cannot or should not be institutionalized. Living well in the community. What success looks like. When hospital level psychiatric care is delivered at home, living well becomes a realistic goal. Even during acute illness, success includes stability without displacement. Patients remain in familiar surroundings, reducing trauma and supporting recovery. Strengthened caregiver partnerships. Families receive training, coaching, and real time support, reducing burnout and improving outcomes. Reduced readmissions and complications. Early evidence from medical hospital at home programs shows lower readmissions rates and fewer complications. Behavioral health programs aim to replicate these results. Equity and access. Home based acute care can reach individuals who face barriers to traditional hospitalization. Transportation challenges, caregiving responsibilities, or fear of institutional settings. Equity must be intentionally designed into eligibility criteria and support systems. Challenges and guardrails. Hospitals hospital at home is not appropriate for everyone. Programs must carefully assess home safety and stability, caregiver caregiver availability, risk of harm to self and others, need for involuntary treatment, access to technology and reliable communication. Enterprise level models emphasize explicit eligibility criteria, 24/7 command capability, and robust escalation protocols to ensure safety. The future, a distributed psychiatric hospital. As health systems refine these models, the future may resemble a distributed psychiatric hospital, one that exists across thousands of homes rather than within a single building. This shift aligns with modern mental health values, dignity, autonomy, community integration, trauma informed care. Cultural responsiveness. It also aligns with people, it also aligns with what people want to heal without losing their place in the world. If for many people with acute mental illness, hospital in the home is not simply a new service, it is a new philosophy of care. It recognizes that healing, relational, environmental, and deeply tied to the rhythms of everyday life, bringing hospital level psychiatric care into the home. We allow individuals to remain connected to the spaces, people, and practices that sustain them. In doing so, we make it possible not just to survive acute illness, but to live well in the community. even in moments of crisis. Okay, guys, that is your A. Give me a bit for a break, please, and I'll be back on with B shortly. For now, Gator Wellness, take care, folks.